everyone. A very beautiful Sunday morning to you all, and a very happy Diwali. We are back after a short break with our episode 92 of Instagram Live Guest Talk with Homeopathy Heals. So, today in this session, we'll be learning lot about the right nutrition. As we all know, there's an old saying that if your nutrition is right, you won't be needing medicine. Happy Diwali to everyone. Of the week. Okay, she's here. Hello, good morning, ma'am.
Good morning, Dr. Anum. Very good morning,
I
and
am
wishing you and everyone who's joined today morning a very happy Diwali.
happy Diwali, ma'am. So, your audio video is clear, loud and clear. And
Loud and
I would like
okay.
to introduce our guest of the week today. She is none other than Dr. Komal Gandhi, and she's MD in homeopathy and DDNP. She's a diet and nutritional expert. While practicing homeopathy over a decade, she has realized that patient has gained their health. They have regained their health better when their diet and nutrition is taken care along with the homeopathy. She has started providing the dietary guidance across a variety of cases with very positive outcomes. She has post specialized studies in diet and nutrition, and she has successfully used the combination of diet and medicine to create a deep rooted and holistic health. She is also as a consulting nutritionist with the Other Song Academy, and she has been successfully combining her knowledge along with the food to treat so many clinical cases like hypertension, cancer, cardiac diseases, diabetes mellitus, and renal failure as well. She's been also conducting the whole food plant based cooking workshop at the Other Song, and the recipe booklet Quick Toss has been inspired by her experience thereof. I again welcome you, ma'am, to Instagram Live episode 92.
Thank you so much, Dr. Anum. I feel it's really nice to be on your platform today, and so many people have joined in. You're doing some amazing work, I must say. And Anum, I can't see your face, but right now.
You can't see my video.
Yeah, I can't see you. I can only see myself right now.
Is it? Can you, audience? Can you tell me
I
anyone
don't
from
know
the
the.
audience if they can see me?
If they can see the both of us, if you could just ask them.
Yeah, dear audience, can you see both of us, or only guest is visible?
Okay, both are visible. Okay, but I don't know why I am unable to view you.
You can leave. I can join you again. We can do that as well if you want to try.
Um. Uh, okay.
Wait, we'll try.
Let's. Do you want to try or
Yeah,
it's
yeah.
okay? I think we'll just go
No,
with the
no, ma'am.
flow.
No, I'll try. I'll try. Wait.
Okay. Okay. Fine. Now I can see you. Perfect. This looks so much better.
Perfect. So, without wasting a time, because I have a lot of non-medicals and my patients, they were very eager as soon as I released the poster. I got a lot of DMs because they were so much curious, about their various disorders, what to eat, what not to eat. So,
Correct.
I call myself very Agyani, apart from homeopathy, if something is there. Earlier, when we started the practice, we used to tell you eat this, you eat not this, and patient used to come what to eat at this hour. We feel hungry at night or something. Then I realized that medicine has gone so far, has progressed so far, and we have an experts for this. So I am very much obliged, I'm very much privileged to have expert on board, and I'm sure my all
Thank you.
patients, my colleagues, my fellows, and the whole Homeopathy Heals family will be able to get benefit out of our today's guest. So without wasting time, let's start our this session. So
Yes.
everyone here is emphasizing on right nutrition, right eating, mindful eating, and there is a variety of influencers, corporate people, medicos. They are promoting something or the other, this kind of diet or that kind of diet. So, being an expert, how do you look at this scenario from a holistic perspective?
That's a very, very nice question to begin with, Anu. And, yes, there are a lot of videos today that are trending, different kinds of diets that are trending. From my perspective, as a holistic approach, in homeopathy also is a holistic science, and the same we apply to diet and nutrition as well. So my approach to this is that, we do not just take specifics of, say carbohydrate, protein, minerals. No, we take into aspect, we take all the aspects of a person's life while giving them any diet plan or nutrition advice. So we will take into consideration the culture that they come from, the traditions that they are following, the kind of food that they like eating, because it is very important that, food is something very near and dear to all of us, and it is one of the most central things in each individual's life. Right from जब जब से बच्चा जन्म लेता है, मतलब द मेन फोकस इज कि अच्छा न्यूट्रिशन कैसे दे, राइट. एंड अभी भी बड़े होके भी हमें खाना पसंद भी आना चाहिए और हेल्दी भी रहना चाहिए. सो वी टेक इनटू अकाउंट all the aspects of nutrition, of culture, tradition, the kind of lifestyle a person is living. ओके अभी कभी कभी कोई कॉर्पोरेट पे काम करता है, बहुत घंटे काम पे है, तो वी हैव टू गिव अकॉर्डिंगली. या फिर somebody who's a housewife, there is a different scenario. She generally doesn't pay attention to her health and end में खाना खाते हैं. और कभी कभी क्या होता है, न्यू न्यू मम्स, ओके, बिकॉज बच्चे मतलब ध्यान में नहीं आता है दैट हाउ मच खाना देना है उनको, तो जो एक्स्ट्रा फूड जो बच्चा छोड़ देता है माँ खाती है एंड देन वेट गेन होने लगता है, पोस्टमार्टम इश्यूज होते हैं. So there are a lot of different aspects that we need to take into consideration when it comes to diet and nutrition and mindful eating. And the most important thing that I do with all my patients, my clients, is to be very very compassionate towards them and non-judgmental approach. Just the way in homeopathy हम non-judgmental रहते हैं, while taking the mental state of the patient, वैसे ही डाइट एंड न्यूट्रिशन में कभी जज नहीं करना है. टू ईच देयर ओन, एंड वी जस्ट हेल्प देम टू गेट टू अ पॉसिबिलिटी टू अ बेटर हेल्दी lifestyle. So that is what I would say, that you need to have a 360-degree approach, not like a घोड़े जैसे हमने देखा वैसे नहीं.
So, ma'am, since you are practicing nutrition and being a homeopath as well, what kind of illness you think requires dietary corrections, and what is the scope of dietary modifications in clinical practice?
There is immense scope, and I will tell you, homeopathy and nutrition together is a synergistic process to heal patients faster and better. And I will name all the diseases where the right nutrition is required, but in general, everywhere along with homeopathy, right nutrition is important and is I would say a non-negotiable. Non-negotiable. ये चीज negotiate नहीं कर सकते हैं हम. Just the way we have a bath daily, it's a non-negotiable, right? Hygiene, brush your teeth daily, have a bath. That way, nutrition along with homeopathy, as practicing doctors, it is a non-negotiable for every individual. Now the diseases, okay, right from say obesity. Today we are seeing मोटापा मतलब बहुत ज्यादा फैला हुआ है, right? Obesity, very very commonly. So also it is not just weight loss related diets. Here I'd like to clarify that nutrition has, there is another branch that is called as clinical nutrition. So wherein all the diseases like diabetes, type 2 diabetes, we've seen like India is the second largest country with the maximum number of patients of type 2 diabetes. So that can be reversed with a good diet plan. Even when you're giving homeopathy, if the person follows the diet, definitely with holistic measures, the person will have regular blood sugar levels. So diabetes mellitus. Then, gut health is very, very important. So, say irritable bowel syndrome, ulcerative colitis, inflammatory bowel diseases basically. Okay, Crohn's disease. Over there, homeopathy can help. For fatty liver, homeopathy and nutrition play an excellent role. In fact, here I'd like to say that I recall a case, Anu, where one of the doctors, resident doctors at the other song, had referred them for nutrition to me. She was on homeopathy for irritable bowel syndrome, and we chalked out a diet plan considering how her daily schedule is and everything. In a week's time, she messaged me, she's not felt so much better ever. So 50% with homeopathy was better, but the rest of the 40%, diet and nutrition played a role. Then even for women's diseases like osteoarthritis, rheumatoid arthritis, this is one very, very dear case of mine. It was Dr. Sankaran who was treating this lady for rheumatoid arthritis. She was bedridden. Okay, and sir was treating her, and because she was bedridden and little bit of physiotherapy that was going on, sir had referred her to me because she was weighing 100 kilos. I mean, just imagine with rheumatoid arthritis, because it was a severe form of rheumatoid arthritis. I think the most beautiful thing that happened, her husband was very supportive. He would do the consultations, we would do Skype calls back then, and after 9 months, this lady comes on the walker thanks to homeopathy and thanks to the right guidance and hand holding of diet and nutrition measures. That she had come down from 100 kilos to 84 kilos in a span of 9 months. So it is a synergistic combination of homeopathy and nutrition. Also cardiac diseases, hypertension, cancers. Okay, of lately, if you read the articles, cancers like sugar is the big poison currently. Then we give them substitutes. So for cancer, so for each and every disease, renal diseases, again, we are seeing a huge amount of renal diseases, Anu. And they're giving them the right diet plan is very, very important. Sometimes patients come to me that they've been to a nutritionist and they just want a confirmation that, okay, is this correct or not? Or sometimes as a homeopathic doctor, when they've come to me for homeopathy, they will ask me, doctor, am I eating this correct? Right? So it plays a vital role, nutrition plays a vital role in each and every clinical disease. So I just, weight loss is definitely one industry that is very much in vogue right now. But beyond that, for all diseases today, the right kind of diet and nutrition is extremely important.
That's actually very true. Uh, I'll take an example. So, there was a time people were having, simple food, or those who avoid outside food, and they used to say, "Arey, tum dieting per ho kya? You're not eating properly." है ना? So
हाँ,
dal chawal khane wala ya kam khane wala was considered, even today, even if you're not feeling okay and you feel like fasting and if you're eating less or just salads or soup, so everyone is
hmm,
like dieting pe ho gaya. So simple khane ko bhi they have, quoted as a dieting word has been used, or I must say misused so much these days.
yes,
And after
yes,
COVID pandemic, there is a massive shift towards the, healthy lifestyle, because people have seen the comorbidities. Okay, people those who are suffering from any lifestyle disorder like diabetes or hypertension, they have suffered, or they have more consequences post COVID infection. So be it diet, be it exercise or yoga, we have seen it has, boom a lot after the pandemic. So is it always a herd mentality which made people adapt this, or what? As a nutritionist, you think there's a sudden shift? Suddenly, people सारे सारी की सारी जनता, सारी की सारी आवाम एकदम से कैसे health conscious हो गई? What is your
yes.
take on this?
So I would say definitely there is a herd mentality, one thing. But even pre-COVID, Anum, see, there are two industries. There is the wellness industry and the illness industry. As homeopaths or as practicing doctors, we are catering to the illness industry. कि कोई जब भी बीमार होता है तो हमारे पास आता है, right? And because something as big as COVID that happened and that has had a huge impact on each one's life, right? People have started focusing on the wellness industry and on the proverb that prevention is better than cure, right? So they are wanting to take the right measures that their health is in good shape, because we've seen through COVID, yes, there have been some very sad cases where people have been healthy and have had problems, but more often than not, people, those who have exercised well, who've been practicing their yoga, who've been eating well, and eating the ghar ka khana, which is so important, very sad that now the trend has changed. But ये जो लोग ने प्रैक्टिस किया है, लोगों ने देखा है कि नहीं, ये अच्छे से गुजर गए हैं वो टाइम से. यहाँ पे ना अनुम, आई मतलब one example to make it simpler for everyone to understand. People are, I think, everybody is fond of celebrities and movies and people watch. So Sushmita Sen, okay, for instance, she went through an angioplasty. People would be knowing last year. तभी everybody said that she was into yoga, she was doing exercise, eating well. फिर भी उसे angioplasty करानी पड़ी. But her doctor said at that point of time, the cardiologist, that because she was doing all of this, she was saved and there weren't much complications. There is something that there is a genetic loading, ठीक है? But it got triggered. But bad lifestyle would have made it like a, सीधा massive heart attack or a massive cardiac failure. But because she was doing all of this, she was saved in the nick of time, and the process was very, very smooth, and she's back on her feet. Just to kind of give you that example. So herd mentality definitely है कि लोग देख रहे हैं कि नहीं, इसके positive effects है. During COVID, there was a huge, revolution towards, being healthy and being self-conscious and being mindful about your health. And people started following those tips and they have seen a change in their life when they practice it. जब तक आप practice नहीं करते हो, आपको समझ में नहीं आएगा. हम कितना भी advice दे दे, हम कितना भी सिखा ले, but you have to implement it and then you will see the difference.
True. I will say, मतलब जैसे लोगों को ना addiction होता है. Even I am a tea addict. मतलब not much, but at least I want tea twice a day. But I would experience a good lifestyle or a 1 hour of workout or eating good becomes an addiction, and it's amazing. You have there are many times, there are days where you might not be able to get up for workout early in the morning, but the whole day you'll keep on thinking about this. Okay, let me get 20 minutes and let me hit the gym or just go for a walk or just run or just go for swimming. So I have felt that. So once you inoculate it in your lifestyle, in your daily schedule, there's so many people, they say time nahi hai. I don't know how patients come and say, Doctor Sahab, time nahi hai. If they cannot manage 20 minutes from their 24 hours,
see,
so time
priority, it has to become a priority. First, when patients come to me, I tell them, you start with a 15-minute brisk walking, simple, or play a sport that you like. Then you gradually increase. And as you said, जिस दिन आप miss करते हो, आपको लगता है नहीं मुझे जाना है. Like today is a Sunday morning, we are here. Morning में आज मेरा भी workout नहीं हुआ है, being Diwali and like things like that. But in my mind, I'm like, नहीं, evening में time मिलेगा तो at least 20 minutes brisk walk मैं करके आऊंगी. Because we have programmed our mind, right? We have programmed our mind and we are feeling so good because the good hormones are releasing. Feel good hormones. And I always say कि अगर आप exercise शुरू कर लेते हैं, automatically your cravings also reduce. Because you are exercising, your body needs that. See, पहले के ज़माने में there was so much of laborious work by default इतना help नहीं था that वो exercise उनका हो जाता था. But in today's day and age, many of times ना no, when I tell my patients, they'll tell me that no, we do घर का काम, we go for grocery shopping, बच्चों को school छोड़ने जाते हैं. हाँ, मतलब they will tell me. So I tell them this is normal physical activity. Beyond that, you have to devote 40 minutes of some form of exercise. It could be cycling, it could be functional training, hitting the gym, or just swimming, whatever you like it. But it is important at least 5 times a week for sure.
That's very true. So today Sunday ka is okay for us, for both of us. Moving up to next question. What long-term goals and strategies we should preach for our patients when it comes to sustainable and mindful eating? Long-term goals.
Long-term goals, very, very important. I would here like to say that, it is about promoting a healthy lifestyle to people rather than just giving them diet plans for some time. Again, I will repeat this. Something that is sustainable. The word sustainable. Sustainable matlab kya hai? Jo long lasting hai, right? Something that is long lasting and easy to do. That is sustainable, right? So what you follow, the right kind of eating habits, and whatever you follow now in 2023, today as of now in November 2023, should be applicable in November 2053 as well. Yani ki aap, the lifestyle that you're living, just the way you brush your teeth daily, you have a bath daily, eating clean and healthy, a healthy lifestyle where there is inclusion of exercise, there is inclusion of right eating patterns, like the right nutrition and good food, and yoga or meditation is a must. It is not a 1 day thing or a 2 day thing. It is a consistent thing that has to be there lifelong with you for a healthy life. So that is what I would say about sustainable eating. I always tell my patients who come to me for weight loss, I tell them, look, I am going to empower you. I am not going to make you dependent on me. I will explain to you everything gradually with hand holding, because see, we give advice. It is not very easy to for people to follow it. Okay, especially when there are people who are used to a certain kind of taste and a certain kind of lifestyle. There is a lot of motivation, hand holding, and compassion that is required, to push them beyond their boundaries, and to push them out of their comfort zone. So we are here for that. The idea is that ये नहीं है कि हमने ये diet follow किया, like crash dieting किया, या there is this fruit diet कर लिया अचानक से, General Motors diet किया, keto किया, मतलब वो वाली बात नहीं है. हम I will take in detail all the possibilities, a holistic approach, and give you a diet plan that is sustainable and which makes you healthy and fitter. And it is not like for 15 days, it is for 30 days, 40 days, it is for lifelong, that I will get you to that track. And it is a healthy lifestyle that we promote. नहीं तो क्या होता है, वेट लॉस करने के बाद दैट यो इफेक्ट, वेट लॉस हो गया एंड आफ्टर 5 months अगेन स्टार्ट बिंजिंग, and then there is double the weight that they gain. So it is a healthy lifestyle that we need to promote when it comes to sustainable eating and mindful eating and conscious choices that we have to make.
That's absolutely true. There's so many patients. I to practice in Pune, so there is, I must say, it is being glorified, eating very fancy diets, such type of salads and such type of platters, and they're losing weight, or shakes, and so many people, they come and market their product. But what I teach my patient is, you choose a diet which you can follow not just for 2 months, but for 20 years or 40 years or for rest of your life.
Exactly.
Even if it is managing the dal, rice and portion of your salad.
Absolutely.
This you can manage rest of your life, and even you can, your kids or your grandkids can follow.
Yeah. So यहाँ पे ना I'll give you this example. आपने बोला ना shakes लेते हैं and then they'll ask you whether we should take this protein shake or whether this is right now going on. I tell them, people take tablets for vitamin C. Just eat your orange. I mean, natural vitamin C. You don't need that tablet in that water and drink it. Ensure that you eat what is naturally available. Then, automatically, matlab, this is something that eat local and seasonal. What do we mean by that? Our ancestors are practicing it, right?
I
So
mean,
what you said is very true. That it is somehow glorified and people feel that they are doing something here, but that is not the ideal way, or I would say it is not sustainable in the long run. आप कितना protein shakes buy करोगे?
मुझे मुझे तो कभी कभी ऐसा लगता है that marketing has a huge effect on healthcare industry कि फैंसी होने के बाद दाल चावल को भी they are making fancy now.
Correct, correct. आज
So,
West में
yeah, maybe you call it as urbanization, you call it as के people they are so much occupied in their work, उनको time नहीं है, they have to open a packet and cook every time.
yeah.
है ना? And they make it like very glorifying कि you can quickly make this. पर दाल
It's
चावल और मसाला राइस बनाने बहुत जान पे आती है. सो मुझे लगता है things are coming back what were previously taught but in a very fancy way, in a very glorifying way.
Yes, in a glorified way. See, it is about putting it across to patients. Like, there are different people who come to us. When there is somebody who's an adult, I like my senior citizen patients a lot because they want to really preserve their health and they will listen to you. So it's very easy to, give them advice. But whereas when you have a teenager who's coming to you for a consultation, so then, you have to kind of be a little versatile and put it to them across in a way that they also understand it. जैसे बोलते हैं ना पैकेजिंग थोड़ा करना पड़ता है मतलब just so that they get on track. One day they will realize that okay, this is the truth, and when they implement it ना, they will feel the difference on their own. एक बार implement करना बहुत जरूरी है. बहुत बहुत टाइम क्या होता है ना अनु, that people take the advice because see medicine दिया medicine खा लेंगे but advice तो खुद follow करना है ना. इट्स नॉट इजी. तो वो फॉलो करने के लिए इज द थिंग. एक बार वो उन्होंने एक बार ट्राई कर लिया ना, देन डेफिनेटली देयर इज अ वे अहेड एंड दे विल फील द डिफरेंस.
That's very true. I mean, और मुझे ऐसा लगता है कि सब चीजों को इतना मार्केट कर किया जा रहा है कि simple things they look very posh. मतलब
पॉश.
हाँ.
यस.
I mean,
वो तो है एक. आई विल टेल यू देयर इज अ वेरी नाइस मूवी इफ पीपल वांट टू वॉच, हंग्री फॉर चेंज. इट इज अबाउट द अमेरिकन इंडस्ट्री बट इट्स ऑब्वियसली कम टू इंडिया आल्सो नाउ. हंग्री फॉर चेंज करके है. हाउ द फूड इंडस्ट्री has made these packets so fashionable and attractive that people want to buy it. They are not reading the ingredients that are there, what they are putting, and people are eating that more and more and becoming lazier and lazier. And the after effects of it. It's a very, very nice, it's a slightly long movie, Hungry for Change. People can, watch how the food industry, has kind of revolutionized, not in a very good way. And ये जो packaging or marketing है, one has to understand in their mind that this is not good for us. People, also there is another sector of people, Anum, where they are getting more and more aware also about it. जब illness घर पे आती है, so they are getting aware about it, and some people are intelligent enough to understand that prevention is better than cure, and they act before it.
okay. Moving forward, earlier there were terms like balanced diet. Used to study in class 9, class 10, right?
Yes.
Then the time came, they were crash dieting and then fruit diet and then keto diet. So as per changing the trends, the lot of things, nutrition business has changed. So being an expert, what is your count on this? Where we are heading to? And what according to you is wise?
Okay. So what I would say that see every diet today that is there, okay, keto diet is very famous. There is something called as Mediterranean diet, vegan diet, plant-based diets, fruitarians. There are people. So I would not condemn any of these paths. What I would say is that every diet plan, there has been a certain kind of research that is done and it has been promoted or it has been put to people. I would say that, a person has to understand what is suiting them and follow it accordingly. And I would here say that, just how in homeopathy we go by the theory of individualization, right? एक ही दो इंसान को कॉफ है बट अलग टाइप का कॉफ है तो अलग रेमेडी जाती है. वैसे ही there is no single universal diet plan for each one of us. All of us are unique individuals. We have a unique body. There are different kinds of body types also that are there, okay, like a mesomorph, ectomorph, different metabolisms that we have, different genetics that we have, different likings that we have, that we have to go as per what suits the person, okay. It has to be tailor made is what I would say, or customized as per the individual you are, as per the lifestyle you are living, and a holistic approach towards it. So just that, one size does not fit all, one homeopathic remedy does not fit all, one single diet does not fit all. So अभी फॉर इंस्टेंस आप दिन में 2 बार चाय लेते हो आपने बोला, विच इज वेरी कॉमन, लाइक रोज सुबह लोग एक कप ऑफ टी चाहिए और शाम को चाहिए. Now there are a few patients who are coming to me where I think that is easily allowable, so I will allow it to them. कभी कभी ऐसा होता है कि बहुत चीनी डालते हैं, कोई कोई कॉर्पोरेट्स में ना दे ड्रिंक 5 cups of tea, तो एक्सेस या मॉडरेशन अच्छा नहीं है, तो I will try to lessen it and get them there. In certain diseases where we want to reverse maybe, and we don't want to give them this, तो वहां पे we will give them a substitute कि भाई आप herbal tea ले लीजिए, कुछ sip on something warm. So it varies from person to person, and we have to exercise that intelligence and execute that intelligence, that what is required where. And a very, very important thing, trust me, Anu, one single right dietary advice along with the homeopathic treatment can make wonders to your patients' lives. You're touching them to the core, and I think there's nothing more beautiful than that. We've had so many such experiences in my practice that, that one change has kind of, brightened up their lives, I would say. So it is very important. The more you study about it, see, you first is, as आपने कहा कि आप पहले homeopathy. Now you are open कि diet and nutrition. So we have to be open to a holistic approach and use all the possible armamentarium that we have to heal the patient. We cannot just be looking in one direction. Let us have a holistic approach, is what I would say. That would be a wise thing to do.
We had a question from audience. They were asking about any dietary tips you want to give for premature graying of hair.
Premature graying of hair. See, this is genetic, one thing, premature graying of hair. Okay. And a dietary tips, there is nothing that, they will eat this particular thing and the premature will disappear. Premature graying of hair will disappear. Okay. Overall, they have to have good foods. One, balanced diet is important. Also protein, good amount of protein is important, and good sleep is also very, very important. Graying of hair, premature graying of hair, stress is one of the main reasons that, one is genetics and stress is the other reason. Also, a lot of people nowadays do a lot of, hairstyling and things like that, because of which that has also started off earlier. So these are certain factors that need to be taken care of, is what I would say, and include protein rich foods in your diet, is what I would say. There is not one single particular thing that will help you with graying of hair. It is an overall approach that will help you.
That's very true. One question is, is always in my mind and, keeps troubling me. I better ask on live only. So there are so many, nutritional supplements are available or roaming in the market, and so many giant pharma companies, they are promoting their products. Are they really needed?
So I would say, in certain cases where people are not consuming the right kind of food or don't have a taste for it, okay, sometimes over there we may have to prescribe sometimes. Secondly, today vitamin D deficiency we all are seeing, okay, because of the ozone layer and people are not moving out so much in the sunlight between 10 to 12 when you get the maximum vitamin D. Also, we are not exposing enough of our body parts to the morning sun. Okay, so vitamin D deficiency is very, very commonly seen, and at that point of time, yes, vitamin D tablets really, really help. Like once a week, either calcirol sachets or Uprise D3 for 6 weeks or 8 weeks. As per the levels that are there, always get the patient tested for it because there can be vitamin D toxicity as well if it is in overdose. So in cases of vitamin D and vitamin B12, see vitamin B12 because today there is a lot of fertilizers that are being used for farming. So the gut bacteria, जो vitamin B12 which was being developed, it has stopped. So there is a deficiency that we see in people. So over there, when we get them tested, we will advise them a vitamin D capsule or a vitamin B12 because it is not naturally available from food, right? And vitamin D, if somebody is ready to do the morning sun gazing and spending that 15 minutes every day in the morning in that sunlight, exposing their body parts and absorbing it. Okay, so it is going to, in the long run, it will help them. So it is a part of the healthy lifestyle that we give to our patients. But yes, when required, we do give these medicines, especially during pregnancy. It is very, very important. So we have to be a little aware about these things. So over there, it is very, very important. And as I said, for vitamin C and things like that, you just eat your citrus fruits, very good source of vitamin C. तो आपको वो देने की जरूरत नहीं है, पर अगर समझो कोई बंदा ऐसा है जो आई हैव सीन पीपल जिनको फ्रूट्स पसंद ही नहीं है, खाते ही नहीं है, फिर तभी कभी कभी यू हैव टू देन टेल देम दैट ओके देन टेक इट इन दिस फॉर्म. मतलब देयर यू हैव नो अदर ऑप्शन. But otherwise, I don't really think it is really, really needed. If you have a balanced diet, you're following the right diet and nutrition principles, living a healthy lifestyle, it is not really required. And vitamin D and vitamin B12, always get it tested and accordingly give the patient. Your voice is not audible, Anum.
There's one question Dr. Vansh is asking, your opinion on use and abuse of biotin.
Of biotech, as in if you can just elaborate
Biotin,
on what
biotin, biotin.
Biotin. Okay, so now there are a lot of these terms that are circulating in the market. Okay, and sometimes what do you call that deficiency. Now if you see, there are so many people who are vegetarians from the beginning. Okay, now biotin is a vitamin found in food like eggs, milk, bananas, everything. Okay, and they are formulating it into a capsule, or even magnesium tablets have now come. If you are eating your diet well, मतलब जो बंदा eggs नहीं भी खाता है is living a long and a healthy life. So there is nothing like that. There are some who are in a particular region, like say somebody who's born in Kolkata. They are living by the seaside and eating fish regularly, which is absolutely fine. We know people living in the Mediterranean region eat one grilled fish. They don't fry fish. That is the problem here कि बहुत fried हो जाता है. So biotin हो या magnesium हो या any such enzyme हो, vitamins, it is easily available. The main vitamins where we need to be careful is vitamin B12, because now it is becoming very, very difficult because of the modernization and the fertilization and all that is occurring, that vitamin B12 levels are less. And vitamin D. Beyond that, any vitamin, B7 ho, B6 ho, koi bhi vitamin ho, if you eat your normal foods well, then it is intact. Also, in certain cases where somebody's had a long standing fever or typhoid for a very long time, and they're not feeling energetic to eat, then sometimes over there you can give those capsules so that they feel regenerated and they feel renewed. Also, in cases of depression, sometimes along with the homeopathic medication, counseling, these medicines will help them feel better and less irritable, because their deficiencies are being taken care of when they are not eating properly.
That's right. There's one question. Dr.
Mhm.
Nilima is asking, what is the role of vitamin supplements in hair care or skin care?
So vitamin supplements will definitely help. See, you will get your vitamins and minerals from all fruits and vegetables. Okay, they are a good source of antioxidants and vitamins and minerals. If a person is eating 2 servings daily of fruits and vegetables in good quantity, you will not need that supplementation. I'll be very honest. And in certain cases where the person is just very, kind of not ready to make the changes in their diet and nutrition, so over there, then maybe give them for some time. But I would say that when you give these medicines, your body is being dependent from an outer source and it stops manufacturing from inside. You're getting into that habit कि body को सब आप ready made दे रहे हो, you know. So ideally try and convince your patients, to get to a healthy lifestyle, and then if required, give those. But it has to be temporary. It cannot be a lifelong thing. Don't make it a lifelong thing is what I would say.
So, ma'am, the audience ranging from BHMS students to senior practitioners, how can one be professionally trained in modifying their clinical practice when it's come to integrating diet and nutrition? For example, I am just practicing homeopathy. Earlier, I can tell
Correct.
patient you can eat this, but things have gone so far. Matlab, है ना?
Hmm.
So, if a beginner like me, if they want to, get my clinical practice better once it's come to diet and nutrition, uh, so how they can do that?
So, to be honest, Anu, when I started my practice, the reason why I did a diet and nutrition course, I'll tell you. There was this lady, at that time I had started with a small clinical room, and this lady was finding it difficult to sit on the chair. Case of hypothyroidism referred to me. She was extremely obese. And मैं उसको while taking the case also, the only thing in my mind, we say we observe the patient as soon as the patient enters, right, from the beginning itself in homeopathy. My mind was like, if she doesn't lose weight, the medicine, how much will it help her? To a certain extent it will, but she really needs to pull down. And I gave her a diet plan with my readings of books in general. Okay, she followed it, and in a span of 2 weeks, when she came, she was down by 2 kilos because all the water retention had gone, and she followed the advice. Correct. Then I thought, rather than my patients going somewhere else, I was reading. I was, one another patient came to me. I gave him a diet plan. He gave the same diet plan to everyone in the office because people saw in 1 month he's doing, like, he's looking better. He's lost a few inches. तो उसने वो करके दिया. Then I thought, why not do a professional course? Because being a doctor, people are listening to me. You have the degree of a doctor, but if you have a structured course, you know a lot more in detail, and you have that confidence that this is the right thing that I am giving to my patient. नहीं तो हमको खुद थोड़े क्वेरीज रहते हैं, कॉन्फिडेंस कभी कभी वी आर नॉट वेरी श्योर अबाउट इट टिल समबडी टेल्स यू नहीं ये चीज सही है बॉस. मतलब ना, आप होम्योपैथी पढ़ते हो तो व्हेन यू आर डूइंग इट फ्रॉम योर कॉलेज, योर टीचर्स हैव टोल्ड यू, you have learned it, you have implemented it. So I did a course in diet and nutrition, and then I started my journey, and eventually I got attached and associated to the other song because they wanted somebody in sync with homeopathy, to practice and give good, sustainable diets. So what happened in the future as we went along, we designed a nutrition guideline course. Anum, we are doing it ever since the lockdown has started, since 2020. We do it online, and wherein we do a comprehensive understanding of all the different topics. Like we take a topic on obesity, then diabetes, how to reverse type 2 diabetes, giving them diet plans. I've had doctors who've attended the course and have reversed the diabetes, type 2 diabetes of their patients. People on injections also have got off it. Then the gut health session wherein we cover everything like, the irritable bowel syndrome, diarrhea, constipation, along with the homeopathic remedy. What is the dietary advice that you have to give for inflammatory bowel diseases, fatty liver, okay? Then what kind of oils should be used or how much of the quantity should be used. Then the next is renal diseases we take. Then women's diseases, PCOD today, such a huge rise, right? So diet plays an important role. Rheumatoid arthritis, osteoarthritis. We see a lot of women suffer more from osteoarthritis. They are going to be prone to degenerative changes. But if you keep your weight in check and by the time you're 40 plus, you start exercising, you do your training, you eat well, definitely there will be a slower progression in the degeneration and you will be strong. So we do that. Then sports nutrition is something that I've recently added in the last time that I did the nutrition guideline course. And I also did one, then I got, that specially for pediatrics आप कीजिए. बच्चे लोग को कैसे हम
Oh,
motivate करें, क्या खाना चाहिए, क्या नहीं. So then we did one because वो nutrition guideline course में pediatrics एक रह गया था. Then we did another session on, for pediatrics, nutrition for children, how to go about it. So we do this comprehensive course and where people, doctors get a full study. मतलब हम जो nutrition course when I do, I have to study anatomy, physiology little bit in detail. But as practicing doctors, with your degree of doctor, whatever you tell the patient, they are going to believe you more because you're a medical student. And let me tell you, it's just about being aware that this is the right thing to do. Once you know that, it's very easy to give. For all of us homeopaths, when we've studied so much of medicine, nutrition, हमने PSM पढ़ा ही है, preventive and social medicine, right? We have been studying all this. So once you are confident, so that's the reason why we started this nutrition guideline course, wherein we do a comprehensive once a week. It is the session. So we are coming up, in fact, Anum, with our nutrition guideline course, which begins next week on 22nd of November. And once a week in the evening, we keep 7 to 9, because what we've realized, sometimes we have patients from doctors from abroad also, people homeopaths practicing in Dubai and other places where they join in. Also, afternoon timings doesn't suit. People are a little sleepy at that point of time and thoda rest mode mein rehte hain. So I tell them that last time also we had participants. So we said, see, once a week you can adjust your clinic timings and we provide the recordings also in case you miss it. See, because we are doctors, there can be an emergency at any given point of time. So that's how we go about it. And yes, I think by till date, almost 500 doctors have done the course. Yes.
that's really huge. And the duration of course, someone asked about it.
So it is 6 weeks. So every Wednesday it will, so the dates will be accordingly, like, 22nd, 29th of November, and then 6th and so on. Every Wednesday from 7 to 9. It is a 1.5 hour session. And in the end, I take questions, whatever they have regarding that session. So 7 to 9. And so 6 weeks, may just once a week. And there is a total comprehensive understanding of that a person can get and can, start immediately applying it in their practice. First apply on themselves, on their family people, on your near and dear ones. First apply it on yourself. Today, why confidently I can talk about a workout? Because I do it. Today, why I can tell people that eat an orange? Because I eat my orange. On my Insta stories, I put fruits ka bhi photos. So that people are motivated that nahi, मैं जो मेरी dish में खाती हूँ वही आपको दे सकती हूँ. That authenticity comes when you do it on yourself. Then automatically, people around you will see the difference and start following it.
That's very true. So many students are asking about the course and everything. You don't worry. After the live session, I'll be posting it on my story, so you can directly connect to ma'am, or you can mail her. I'll drop all the details about the course, and you can join the course from 22 only, right? Am I right?
Yes,
Even
correct. 22nd.
even I am excited to be part of it. And I'm very sure I'll be able to
Definitely.
make my clinical practice even better if I'm able to, tell patient what to eat, what not to eat, or, how they can make their meal plate even better. And that could
Even
help
better.
them in their lifestyle disorders as well. And I think that's a win-win situation. And trust me,
Definitely.
you gain lot of trust of patient when patient feel it. Ek to we are homeopath. We take long cases. So patient feels very much
Hmm.
connected with us. And once you start telling
Exactly.
them that you eat it and you don't eat it, please avoid it. Patients are more connected to us. The doctor is even concerned about our diet also. They are not
Very.
just a drug dealers and writing get it from a medical or get it from anywhere or you take this supplement. Just you need not to do anything. So they feel
Yes.
that it's actually making a physician to a family physician. They're inoculated in
Definitely.
family.
अनुम very बहुत अच्छा point आपने बोला है that they are so connected to us when we take all the possible details like right from family history उनका हम दिनचर्या भी तो पूछते हैं ना daily routine खाना पीना आता ही है उसमें and when you give this advice to your patients na they feel that अरे this doctor is also very knowledgeable. They will come to you only rather than going anywhere else than for diet and nutrition that my doctor knows it and is explaining to me.
True, true, true. Very true. Very true. I to remember when I was in internship, I used to, and in internship you take cases like what has been feed in your mind that you have to take appetite, then thirst,
हाँ,
then thermal, then desire, then aversion. You
correct,
don't have
correct.
to miss. Patient is not telling you have to probe the patient like that. So I remember back in my internship days, like, almost a decade ago, 2014 की बात बता रही हूँ मैं. 14,
Ah,
15.
okay.
So patient used to, patient was so much flattered, उनके parents रिश्ता लेके आ जाते थे hospital में. That girl was so
Oh,
much interested. I remember those days, and they
ah,
used to come for regular follow up because you have to check tongue, you have to check hair, what you eat, what
correct.
not. So I remember
Nails
homeopathy
check
is
करो.
so everything. But the doctor, and at times we check for sweat also, no, the
हाँ,
warmth of. So
yes.
they feel so overwhelmed. That a girl who is like 22, 23-year old, and they were so much concerned about me. So everyone, few patients used to take it very personally. The next day
Ah,
they asked me their patients in hospital, and they're like, for what? लड़की दिखाने लेकर आए हैं because लड़की is so much concerned about our son, but
and
लड़की is doing her job only.
correct,
Taking
correct.
case. So it kind of
Very,
taken it
very true.
progressively and taken it in a very positive manner that I'll be able to touch lives. I was able to, get connected to people. That
Very
makes me
true.
different from a drug dealer. I'm not just giving them or drugging them with medicines.
Yes, yes,
Yeah,
yes,
I'm
yes. I
inoculated in
mean,
their life.
you are doing, in fact, I would say here, today we are reaching out to so many people thanks to the platform that you have built. You're touching so many lives in a positive way. नो मतलब आप एक बंदे की भी लाइफ चेंज कर सकते हो ना आपके
True.
वजह से
Enough.
आपका जीवन सफल है.
True. True, true, true.
So,
So, ma'am, I would request you after the session that you please
yes,
even either inbox me the details of the courses, or
I
if
will do
someone
that.
wants to consult you, because there are few questions that people want to consult you as well if they can get their online appointment. So, do let me know the details. I'll share it on the story. And
Definitely, definitely, Anum. Yes, I will do that. I
so,
will do that. Also, Anum, on my page itself, on my handle, Insta handle, I have posted a video regarding the nutrition guideline course, which is currently pinned also, so they can see immediately that what I'm going to be teaching. There is a detailed video and the write-up, and I will send you the brochure as well. I have a team of doctors. My team members are Dr. Zaida, Dr. Mitali, and Mrs. Abha Sharma, and also one of my clinic numbers is there, so they can contact any of them and the process can be done smoothly.
That's so amazing. Trust me, इससे अच्छी दिवाली celebration का start हो ही नहीं सकता था, because for rest of the year we'll be eating properly, eating good, and eating mindful as well. I am
Yes,
so much obliged to you, ma'am, that even on a festival day you spared out your time and you had a word with us, and it was an enlightened session, I must say. Thank you so much for coming on Guest Talk with Homeopathy Heals and being one of the century guest speaker with us. We'll be soon
uh,
turning 100, no?
yes, 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 definitely. Thank you so much, Anum, for all the kind words, and it's been my pleasure, to be honest. To see so many people who are equally with me over here, with me and you on a Sunday Diwali morning. So it is truly I feel blessed that it is God's grace today, and wishing all of you a lot of light in your life of health and happiness and prosperity in each one of your lives. Have a lovely Diwali. Enjoy your gujia and enjoy your kaju katli or whatever it is. Just remember one thing, that Diwali पे अगर खाने के लिए मुझे कुछ advice देनी भी है तो one is guilt free खाइए and eat light, stay bright. Okay, so
That's so good.
eat light and stay bright this Diwali. काजू कतली खानी है, 2-3 पीस बहुत अच्छे से खाइए, मन से खाइए and stay bright. Don't make it a meal.
Thank you so much, ma'am, and we'll definitely look forward
Yes,
to have more sessions, detailed sessions with you in the future. Thank you so much for being
definitely.
here.
Anand. Yes, thank you so much. Thank you.
So I hope you all have enjoyed the session, and I'll be dropping right away in the story. Do write us about the feedback and learnings that you have learned from today's session, and we'll be back very soon with another episode. Stay tuned with us. Thank you for all love you have given us to Instagram Live Guest Talk with Homeopathy Heals. Till then, stay healthy.